Our bodies need water. If you think about elephants, have to drink about 50 gallons of water a day. First key concept I want to share with you, our bodies are 70% water. Our brains are 80% water. Just to breathe each day, we need about 2 to 4 glasses of water to breathe. It moistens the air. That's almost half a liter to 1 liter a day just for breathing. Our kidneys need water to function. About 1.5 liters per day, or about 6 glasses of water a day. To just between breathing and kidney function, we need almost 10 glasses of water a day. We also need water to detoxify via liver and kidneys. We also lose water in other ways, for example, sweating. Water can be used as many ways to help us stay healthy. One way is to help relax and exercise. It can clean our bodies. It can help with weight control. Sometimes we think we're hungry and we might just be thirsty. Water is important. Lack of water increases your risk for urinary tract infections, kidney stones, heart attacks, blood clots, and even asthma. And as a study from the University of Buffalo showed that people with asthmatic attacks get less frequent attacks if they are well hydrated. Lack of drinking adequate water can lead to many other diseases, including stroke and heart attack, kidney stones, gallstones, heat stroke, renal failure, and blood clots. Key concept number 2, lack of drinking adequate amounts of water can lead to significant disease. Other than preventing kidney stones, it can also help us with keeping our bowels regular and getting rid of toxins in our bowels, preventing colon cancer. It cools us. The sweating maintains our temperature. It decreases the workload on our heart and decreases our risk for heart disease and heart attack. One study done at the University of Arizona showed that people that are dehydrated have symptoms similar to having a leaky valve or mitral valve prolapse. The important thing is to prevent blood clotting. Dehydration is a major factor in causing blood clots in the legs. Water protects us against germs. Water treatment can be used for vascular type headaches. People are not camels. We don't store water, thus we need water every day. Between 9 and 12 glasses of water every day. Key concept number 3, we need to drink about 9 to 12 glasses of water per day. More is needed if we are sick or if it's dry or if we exercise. One study showed that only about 1/3 of people drank enough water every day. How much do we need to drink? Well, you can calculate it with your weight if you want to use this formula. The Institute of Medicine says men need to drink about 3 liters a day and women a little over 2 liters a day. When it's dry, you need to drink more. When you're flying, you need to drink more. And when you're sick, you need to drink more water. One study done, called the Adventist study, showed that if you drank more than 5 glasses of water a day, you halved your risk for heart attack. However, if you drank other liquids like soda or coffee or beer, you increased your risk 2.5 times. There's nothing like water, except maybe natural decaffeinated herbal teas or water-rich fruit like melon might replace some of that 9 to 12 glasses of water you drink a day. Beer, coffee, soda do not count as water. There is nothing like water. Coffee, soda and beer does not replace water. Natural caffeine-free herbal teas like red bush tea might replace it. Water-rich fruits like watermelon and cantaloupe does or can replace a glass of water. Caffeine has many problems and robs our body of essential nutrients and also causes an increased risk for cancer, elevated blood pressure, and also increases our stress and other problems in life. Caffeine robs the body of nutrients, calcium and water, and decreases melatonin production. Does alcohol count? On the Mayo website, you might read further towards the risks of alcohol, including cancer, pancreatitis, alcoholic cardiomyopathy, stroke, cirrhosis of the liver, injuries, and suicide. Alcohol is the third leading cause of death. The New England Journal showed that there is a 30% increase in breast cancer in women consuming as little as 1 drink per day. Is red wine good for you? You must have heard that it's good for you. Well, this is the largest waterfall. Who if you recognize it? Well, it's the largest waterfall north of Tennessee, south of Ohio, west of Virginia, and east of Indiana. But if you look at it, compared to Niagara Falls, this is Cumberland Falls, the largest waterfall, qualified, compared to Niagara Falls. When you think about alcohol and red wine, this might be the benefit of red wine. This is the risk involved. The medical journal Cardiology Clinic summarizes this as follows. Says, given the complex nature of alcohol-disease relationship, alcohol consumption should not be considered a primary preventive strategy. Is red wine good for you? Well, one thing to consider is it's the number one cause of death in the ages between 15 and 30. A lot of cancer deaths are related to it. It's a neurotoxin. About 43% of people will be affected by someone abusing alcohol. 50% of highway mortalities are related to alcohol. 90% of rape cases at colleges are associated with alcohol, and it's the third leading cause of death. The statistics go on. 500,000 Americans who are dependent on alcohol are between the ages of 9 and 12. To summarize, we need water. Men about 3 liters a day and women about 2.2 liters a day. Keeping track of how much water we drink with a daily journal or a diary helps us keep track of our water consumption. Water treatment can be used for a variety of treatments, including headaches and stress and restless leg syndrome. The risk associated with red wine and alcohol far outweighs the benefits.